Health problems in India. The assessment of the health status and the health problem is the first requirement for any planning effort to provide the healthcare services to the India. What is health? Health is a complete state of a physical, mental, social well-being, not merely the absence of disease or infirmity. So once there is a problem, there need a solution. So in this class, we are going to see clearly about the what are all the list of health problems in India. Communicable disease problem, non-communicable disease problem, nutritional problem, environmental and sanitation problem, and medical care problem and population problem. These are all the major health problems in India. We are going to see what are all the strategies to overcome, what are all the challenges our Indias are facing. Before going to see what is the challenges we are going to face, especially first thing we are going to see about the GDP. GDP compared with any other country, still 2005 we are spending only less than 1 rupee, 0.9 percentage. During the NRSM time, within 0 rupees to 2 rupees, 2.75 percentage, nearly 3 rupees until now we are spending. The great challenge is the health only we could be able to do this much. Comparatively any other countries, they are spending nearly 18 to 20 percentage. If you take America and other countries or UK and all, taking 18 percentage, 17.5, 18 percentage. If you take China, they are taking 6 to 7 percentage. All the small countries also spending more, but the India spending these 18 percentage for our militants. But this from 1 rupee to 2.75, these 3 percentage, we are doing a very much drastic changes. Now the Ayushman Bhavan, the plan is very much successful plan, and India is planning to give the health policies to all the Indian citizen, nearly about the 5 lakhs of the healthcare policy. So we are providing. So let us see in this class first what are all the main major health problems. First one is the communicable disease problem in India. Communicable disease problem, it's not only the today's problem, from the many decades we are facing the problem. The major communicable problem currently is called the malaria, tuberculosis, diarrhea, ARI, leprosy and filariasis and AIDS and other problems. Let us see malaria. Malaria, nearly 15 million cases of the malaria are detected. Nearly about 19,500 to 20,000 deaths are happening annually in malaria. Tuberculosis. India has the world's largest TB patients. It's a TB epidemic, you can say. Nearly about 192 to 1 lakh population every year. Nearly 2.2 million they are developing in new TB cases every year. And then diarrheal disease problem. Diarrheal disease problem is also one of the vulnerable problem for children, mainly it is affecting. Nearly 2 million deaths occurring annually. Nearly 13.91 million year. And next is called ARI, acute respiratory tract infection. This also mainly children are affected. Children 5 years. If you see why children are affected, physiologically, anatomically, their lungs is not completely developed. The surfactant developed till the 8 years. So they are more prone to develop the chest infection. And COVID-19, we lost most of the people in 2021. And leprosy is also decreasing day by day, but still we cannot eradicate. It is decreased to 9.73 per death per 1 lakh. It has gone population 5.52 in 2021 to 22. It is really reducing from the 9.5, 6.5 to it's come to the 5.52. Next one is a filariasis. Filariasis also, India has a 40% of the world's lymphatic filariasis. So this is a Culex mosquito mainly causing these diseases. Mainly we are programmed as National Filaria Control Program, Leprosy Control Program we have, and then tuberculosis, DOTS program we have, malaria eradication, malaria control program we have. So all these communicable disease, whatever we have lot of government implemented programs are there. If you take AIDS is also one of the biggest problem. We are tie up with the NACO. So this one with the non-governmental organizations are coming forward to give the AIDS treatment, antiviral, retroviral therapy. along with the government hospital. They are doing screening, and they are nearly 5,000 rupees it cost around to give the 1 month tablet to the AIDS patient, HIV AIDS patient. Nearly, if you see, 2.40 million are living with HIV. 42,000 are annual death occurring by that by HIV AIDS. It's not a disease, it's like a syndrome, HIV AIDS. What is the other diseases like Kala Azar, meningitis, viral hepatitis, dengue, Japanese encephalitis, enteric fever, helmintic infections are the major cause of the communicable diseases in India. What about the non-communicable diseases? Actually, if you see from 1950s, if you take this non-communicable diseases are decreasing because of the Indian governmental various effort, UPI program, expanded program of immunization, many programs and sanitation program, many things they have implemented. Then nowadays the non-communicable disease problems are increasing. What are all the major non-communicable diseases are hitting our country? Especially heart diseases, cardiovascular diseases and lung diseases, stroke, cancer and diabetes mellitus. If you see, 5.8 million people die with non-communicable diseases every year. They are dying before the age of 70. 60% of death in India caused by the variety of the unhealthy diet, no exercise, urbanization, and no healthy food styles are not there. In 2020, 1.3 million people died by the cardiovascular diseases. In 2021 to 2022, 1.46 million were affected by the cardiovascular diseases, and 12.8% of diseases are increasing per annually. By 2025, it will increase up to 1.57 million. It is a great challenge for the Indian government with the GDP, what they are doing, how they are going to face this people, what are all the changes and what are all the innovative program they are going to bring it about. Non-communicable diseases. Stroke. This is the second common death in India. Between 105 to 152 per 1 lakh people per year affected by the stroke. Diabetes. India is becoming a diabetic world's capital. 10.1 crores in India people are affected by diabetes 2023. 124.9 million it will increase by the time they are expecting to 2045. What are we going to do about this? It's a world second country with a lot of diabetic people in India. Lung diseases, COPD. Its prevalence is 10.4%, 11% in urban and 5.6% of people there in the rural area. Urban, there is COPD mainly by the pollutions, automobiles. You can see one of the greatest example in India, the Delhi. Why the Delhi is affected with the highly polluted, not only by the vehicle, the farmers are burning the sugarcane dust. So they are not following the natural one. The Delhi is highly polluted. So these are all the causes for the main COPD. This one. So communicable diseases are many. Non-communicable diseases are 5-6, but the number is increasing than the communicable diseases. Let us see nutritional problems. The nutritional problem, India is a developing country. So many people are eating only one time a meal per day. So that much poverty is there. The poverty is lead to protein energy malnutrition. 25% of all hungry people in the world live in India. 70% of the children suffer from the PEM. What is PEM? Kwashiorkor and marasmus in Asian country. Which is the state which is mainly affected is Maharashtra, Bihar and Gujarat. So these are all the highly affected states by the PEM. Nutritional anemia. Nutritional anemia, one of the root cause of the maternal mortality and infant mortality death in India. The research shows during CSSM 1992, they found out that all the programs, Indian program was, all the family planning, all these target program was not achieved. Mainly, the root causes mainly because of anemia. If you see 25% of the men and 31% of adolescent boys also were affected by anemia. 40% of all the children between the age group of 6 months to 59 months that are affected by the anemia. 37% of the pregnant women are affected by anemia, and 30% of the women between the 15 to 49 years with anemia. This is the statistics in 2023 May. Low birth weight. Low birth weight. It's one of the important cause of increased mortality in India. The child mortality, newborn mortality, neonatal mortality. 18% of the children under 5 are born with a low birth weight. 18%, 100 out of 18 children born with this one. The survival rate is very poor because the infection rate is so high. You need incubator, you need hi-fi sophisticated healthcare facility to save the low birth weight babies. Unlike other countries, which their countries are easily having access to that much sophisticated healthcare services. This is the statistics in 2023. Xerophthalmia. Xerophthalmia is a blindness, this kind of a blindness disorder. It's affecting the eye. 1.6% to 4.4% causes for the night blindness is due to xerophthalmia. 0.6% to 2.7% is mainly by the Bitot spots. All this main because of vitamin A deficiency. So government has introduced vitamin A prophylaxis program to the poverty places and iodine deficiency disorder. Iodine, it's a great endemic outbreak, especially if you see Himalayan region. 70 million people are suffer from the goiter. So 200 million are at risk in India to develop the goiter. What does the government do? They're just doing the fortification. What is called iodine salt fortification they are giving. It's not the thing. Indian government is not doing nothing, but it is doing most of the nutritional problems he's been trying to solve. Various programs, ICDS program, Applied Nutritional program, Midday Meal program, Vitamin A prophylaxis program, specific nutritional program, and they are recruiting ASHA, USHA, DC, and covering up all the population. We are doing the wonders. India is the first country to introduce the family planning services. Also, the main problem is nearly 20% of the people only access to the primary healthcare services. So, the healthcare utilization has to be increased also. For that, what we have to do? We have to have the awareness. Why it is not there? Awareness, lack of awareness is there. Mainly very poor states like they have. That is why in NRHM they focused the highly 18 status to create the awareness. They have developed the cadre called ASHA. Okay, let us see. Only this is the nutritional problem, nothing else? No, there is some other problems also hitting the poor population, below poverty line population. That's called the letharism. Letharism is the disease which is coming due to mainly affecting the bones. They are consuming the lentil, the red, pink color lentil which they are providing through the ration shop. They have some of the poison like bioxyaminoalanine is present. So continuously eating that, they may develop the letharism. So what do the poor people? So we have to teach and create the awareness to soak the lentil for 10 to 15 minutes in hot water, then clean it, then you can prevent the letharism. Dental fluorosis, it's mainly due to the fluorine content high in the water leads to this dental fluorosis. These are all the other minor nutritional problems in India. Next is the environmental sanitation problem. Environmental and sanitation is the root cause of the any other disease problem, communicable disease and other disease problems. So this is the first one is the lack of safe water. Then the population explosion. Open field defecation. If you not believe it or not, 11% of the people still are using for the open field defecation. Only the statistics says that 157 million people in 2022 still they are having defecation. Many voluntary organizations, you might have remember the Rockefeller Foundation came forward, built to construct the toilet, and government also 2 rupees toilet also they constructed in the village, but people still the felt need not there. That's why they are not utilizing it. Then water pollution and falling of the groundwater going down and down. Either we have a great rainfall or the drought. So what dry climate, both extreme is there and lead to lot of communicable diseases mainly because of this. And 163 million lack of good water. People are in lack of good water. They are using the very polluted water. They are more prone to get the communicable diseases. Next one is called the medical care and the population problem. Medical care is the lack of awareness first of all, and inadequate staffing is there if you take staffing, and the scarcity of the drugs and medicine in India, and migration of the people from the rural area to the urban area. So there is an increased number of urban slums. So cities like a highly populated city like Kolkata, Mumbai, Bombay, Chennai, Ahmedabad, New Delhi, like that. 74% of the doctors are there in urban. So who will be working in a rural area? No one like to be work in rural area. All they want to come to the city. And the poor suffer from the ill health, and that's the reason. 50% of the villages there is no access to the road, and if there is the road they have access to healthcare services. Many of the cities do not have the road, and the cost of the healthcare is very costly comparatively. The healthcare cost is a dream for the poor people. So, as I told you in the beginning, the GDP compared with the other countries, the healthcare spend is less in India, but still, so many strategies are there to overcome. If we do, India can do the wonders. How to do? What to do? First one is strengthening the immunization services. If you again strengthen the immunization service, are we not doing that? Yes, we are doing that. EPI immunization program become the universal program of immunization. Also, we are not happy. The government cannot achieve it. They have introduced Indradhanush program. Indradhanush program is covering most of the children. That is the effect. Now the communicable diseases are drastically reducing. Still, we need to be strengthen these services. How to strengthen? Through the primary healthcare center. So we have to construct more primary healthcare center? No. Strengthen the primary healthcare center by the new facilities and infrastructure and empowering the manpower. How to empower the manpower? So empower the primary healthcare center by the BMOC, CMOC and EMOC. Basic maternal obstetric neonatal care, critical maternal obstetric neonatal care. Understand? BMOC, CMOC, EMOC, emergency maternal obstetric neonatal care. For that you have to train the doctors. So all the doctors are MBBS. So how to train them? There is a voluntary organization coming, that the Gynecological Society, as we have discussed in the previous video. So they had sent it for the training for 6 months. After that, these doctors are eligible to treat the gynecological patients. So, and then infrastructure, you construct make the primary healthcare center as a first referral unit. Everything will be available, even with the operation theatre and with the bed. And infrastructure development, as I told you, increase the doctor population ratio. According to World Health Organization, 1:1000 is the population ratio. But in India, currently, 2024, 1:834 doctors only available. These doctors are allopathy as well as the Ayush doctors. Then think about it. An increased number of medical colleges and nursing colleges has to be increased to improve the population ratio of the doctor. And increase the number of the hospitals, the government hospital, and increase number of the health spend, that we are spending nearly less than 3%, 3 rupees, right? As I told you, that less than 0.9 paise we were spending till NRHM. After NRHM only we have increased it. Then increase the health spend, as I told you, and better health education and awareness. We have to create an awareness. How to create awareness? Through Anganwadi workers, Balwadi workers, and 18 highly focused state ASHA can create and apply the triple P approach. What is triple P approach? Public-private partnership approach widely. So the central government has to encourage the state government, compare with the NGOs, and make the public-private partnership approach successful. And then conduct more capacity building program, empower the people and do that one, and implement all the healthcare schemes widely. What are all the healthcare schemes? Janani Suraksha Yojana, that's a centrally government sponsored scheme. Then RNTP, revised National Tuberculosis Program, Pulse Polio Program, Blindness Program, Leprosy Program. All these programs are channelized through Primary Healthcare Center. So empower the Primary Healthcare Center 24 hours. How is that government has done? In what way they have done? Yes, they have done 24 into 7 hour service, 108 ambulance service, decentralized services. Now currently has been improved. India is the country beautifully doing with a low economic, with less health spend, with challenging this population. It's doing the wonders. So that is the medical care problem. How to overcome the strategies? What is the population in India currently? Nearly 1.5 million people. It is going to increase. Now 1.3 to 1.4 million people. It by 2030 it will be 1.5 billion people. It will be 2 billion people in 2050. So this is the great challenge. However, we are putting the lot of skill spend. That is also due to the overpopulation. It's a highly demand to reaching the healthcare services to the each and every individual in the country to the free of cost. Anyway, Ayushman Bharat is there. Now we can see how the Indian government's doing the innovative programs to bring the challenges. So today's class we have seen what are all the health problems in India. It is always asked for the 5 mark, sometime 10 mark questions. According to the mark you have to describe it. Thank you.